the Mary T. Perspective Show, and I want to show you something and someone here today that you are really going to learn a lot from. I know I have, and I thought maybe I would share it with you. I have with me today Miss Darnisha. She is from the Atlanta area. She flew in just to talk to us, and she has some very interesting and important things she wants to talk to us about, all these diseases that we have out here. Darnisha, can you give me a little bit of, about yourself?
Yes.
I
am formally a scientist, specifically a microbiologist and chemist by degree and training, turned business development and licensing professional in the pharmaceutical research and development sector of the pharma industry, turned entrepreneur, pharmaceutical entrepreneur, and that I am now the founder, president, and CEO of Ennaid Therapeutics.
What is Ennaid Therapeutics?
Ennaid Therapeutics is a development stage pharmaceutical company, and we're developing a number of cures for infectious diseases, particularly mosquito-borne viruses that impact our world every day.
Such as?
Some of these viruses are dengue virus, which impacts 400 million people in the world.
Oops.
400 million contract this disease. That's more than the U.S. population alone. And that's a mosquito-borne virus endemic to subtropical and tropical countries, but not limited there. Because our own CDC, Centers for Disease Control, have said that 3 billion people in the world, regardless of climate, are at risk for contracting dengue. West Nile virus is another one of these mosquito-borne viruses. West Nile impacts and infects 30 million people a year. So we are developing cures for these particular diseases.
Now you say over 400,000 people,
400 million.
400 million people, excuse me, will be affected by it or is affected by that. So we here in the United States, we're not exempt from this?
We are not exempt. As a matter of fact, the mosquito that carries the dengue virus is currently right now in our country. Florida has had outbreaks, California, New York, as well as Hawaii in recent years, as recent as last year for Florida and New York.
So why did Ennaid Pharmaceuticals, why did you birth this company? Why did you start this company?
We wanted to really make a difference in the industry. We believe that sickness and disease simply represents problems that need a solution. They don't have to represent a way of life. So we are cure focused as opposed to only pacifying symptoms.
Managing.
Not just to manage symptoms. We want to cure that disease and allow people to go on about living abundant, healthy lives.
What are your short-term goals?
Our short-term goal is to continue our animal studies and continue raising the capital that it will take to continue these studies. And those are our short-term goals. It costs us $40 million for the entire program here, and that's our short-term goal.
Okay, hold them up, Joe. Hold them up. You say animal studies. What animal studies are you?
Currently, in order to get any drug approved, you have to go through a series of testing that our FDA requires, rightfully so, because you have to prove safety and effectiveness in an animal model first. We are currently testing on mice, and then you move on to testing safety and effectiveness in humans. And so right now we are at the animal study stage.
What kind of mice? There are all kind of mice. What kind of
Yeah,
mice?
it's a particular strain of mice that have been labeled AG129. Our friends at the University of California at Berkeley are responsible for developing this perfect mouse model, if you will, for dengue.
Okay.
Yes.
So they're the people that's out here. But so now, make sure that there's no misunderstanding. You're not out here testing on our man's best friend, the dog, or our cats, or what.
And these practices on animals are very, very humane. The agency, the FDA, makes sure that there are complete humane, strict guidances that you abide by to make sure that everything is done with love and care.
Okay, now you say you are the founder and CEO of
Yes, I am actually the founder, president, and CEO. It's no secret to anybody watching this that I am a black female, and I'm actually one of the first black females to be the founder, president, and CEO of Ennaid Therapeutics. This is something I gave birth to, being greatly inspired. I've got a fantastic team that I've rounded up, who truly believe in the vision, the mission of the company, and we work very closely together. So I'm not a prima donna. I did give birth to it, but it's certainly a team effort. It really is.
Okay, now what's the website for that? How many?
EnnaidThera.com, and that's spelled E like Edward, N as in Nancy, A-I-D like David, T like Tom, HERA.com, EnnaidThera.com. We'd love to have you check out our website and contact me and say hello if you feel free to.
Now, you told me about your short range goals. What about your long range?
We desire to be the #1 pharmaceutical company in the world.
Wow.
Very plain and simply.
Yeah, female to boot.
That is our ultimate goal. But we really want to make an impact, and we've got a dramatic focus on the patient. Even though we're development stage, we're about 4 or 5 years off from having our drugs on the market and being able to be taken, ingested by patients. But that's our focus.
Well, I tell you what my focus is right now is to make sure you hurry up and develop this thing, because I do not want that, what's the name of that?
Dengue virus.
That dengue virus. I don't want that dengue virus. And I'm an outdoor person. I garden, I hike, and I have learned, I mean, I visit Florida quite often, so I'm really a little bit shaky now about this.
Well, just be encouraged. There's hope.
Hurry up,
There's
please.
hope. There's hope.
Okay, now, you followed your goals in developing and giving birth to this pharmaceutical company, and you're moving right along. How would you, or what would you say to someone who have dreams?
Yes.
And would you encourage them to just dream small or dream big?
Oh, you want to dream big, and you want to follow your passion. Follow what you're just compelled to. What are you drawn to? Let it be a natural kind of following initially, right? And then what interests you? And don't be afraid to explore certain areas or certain things. Don't be afraid to talk to people. Do some research. And it's not a dream, in my opinion, if it's not a big dream. Big is relative, though. You know, you may not want to be the #1 pharmaceutical company in the world. You may not want to impact the globe by helping 400 million, but let it be big to you. Let it inspire your heart, energize you, and have the courage. That's the #1 thing, Miss Mary. Have the courage to know that your dream matters. And you've just got to be willing to step out on the, what I call the leading edge. Be willing to be a pioneer, and you will see that dream unfold right before your eyes. And make sure you're having fun with it. If you're not having fun, you might be doing something wrong.
You know what? That's what I always hear when I'm watching sports and whatever. All of them say that they're having fun.
Yes.
Yeah, you know, the football player gets knocked down and in the
Yes.
concussion, but he's having fun. So that's what I always say. If you gotta have fun with it.
Yes.
You know, like today I'm having fun with
So
talking
am
to
I.
you, and I'm so happy that you're here, and I'm telling everybody about you. Oh my God, I'm having fun. I'm thinking big, and I'm thinking I'm dreaming big. But I'm here to tell you, not only must you think and dream big, you must be willing to do the work. And you may say lean in and do it, but or step up and do it. I call it step up day. It is time to step up. She stepped up.
Yes.
Miss Donisha stepped up to the plate, and she is leaning in.
Yes.
Thank you so much for coming.
Thank you so much, Miss
I'm
Mary.
looking forward for this drug.
That's right.
Because I want to
That's
get
right.
back out there. and I don't
Keep
know how
watching
to-
and reading. Keep watching and reading.
Okay.
We're making waves, and we'll be on the market soon. 4 or 5 years, we'll be there. Okay?
Okay, I'm waiting for it.
Thank you.
Okay, thank you so much.